fruits of your wise decisions. With Britam, we are assured of over 55 years experience in life insurance, health insurance, general insurance, investments, and retirement solutions. Britam, with you every step of the way.
Hello, good evening and welcome to the Medical Health Show here at GTN TV. My name is Mumbi Mavuti and today we are going to be talking about meningitis. But before we go there, are you aware that your favorite TV has been nominated for the Kuza ICT Awards, and we need your vote to win. We need your vote to bring this home, and kindly do so by visiting www.kuzaawards.co.ke or by simply sending the word Kuza to 15601. We are really counting on your vote to bring this award home. And now going back to meningitis, joining me in studio is Dr. John Maore of Odaya Level 4. We're going to be tackling this disease together. I want to give him a moment to introduce himself to our viewers, and thank you so much for making time for us. Karibu. So take this moment to introduce yourself to our viewers, and then we'll proceed from there.
Thank you so much. My name, as you heard, is I'm called Maore John. I'm a medical officer practicing at Odaya Level 4. Congratulations, by the way, for the winning of the award.
Thank you.
And we hope that all will go well. I want to thank the people of Odaya and the county, Nyeri County at large, under the leadership of our Governor, Mheshimiwa Kahiga Mutahi, for the leadership that he has actually continued to offer in our facilities and also in the county at large. Thank you.
Thank you so much. You're going to be voting for us after this because we need every other vote that we can get to bring the award home. Yes, so we're going to be talking about meningitis. That is what we want to educate our viewers on today. So what is it?
Meningitis is actually an infection or rather inflammation of the central nervous system. So we have systems in our bodies. And today we'll focus on one of the infections or inflammatory disease, which is called meningitis. Meningitis is derived actually from two words, meninges and itis. Meninges is actually the tissues that covers the brain, and when you talk with itis, we mean an inflammatory disease or a condition. So why am I introducing it? Because simply it's just an inflammatory disease that affects the brain tissue that covers our brain. Our brain is covered by three tissues. We have the pia mater, the arachnoid, and also the dura mater. But of concentration today, we concentrate on the two tissues, which in combination causing meningitis. We call it leptomeninges. We also have other inflammatory conditions, for example, the myelitis, which affects the spinal cord, encephalitis, which affects the brain itself. But of essence today is meningitis, and we have a clinical way of assessing this condition. I'm sure you've heard about CSF, which is cerebrospinal fluid. So this is what actually our target as doctors usually use to actually base our clinical assessment and our diagnosis of meningitis.
And how fatal can meningitis be? Because we're talking about the brain, tissues around the brain.
Actually, which we'll cover in the complication of meningitis. If it's not taken care, we have a couple of complications that go on. Brain actually is one of the key organs in our bodies, and if it's not taken care of, can cause a fatal disease. In terms of populations, we have extremes of ages which are actually affected more. and one of them is below 5 because you realize the immunity is not fully developed, and those who have immunosuppressions, which we will look at as we go on.
Yes, we are going to be talking about the risk factors. Who is at risk? Who is more predisposed to contracting meningitis?
Thank you very much. Anyone, to start with, is at risk of getting this inflammatory disease. But we have some of the risk factors which can predispose one to get meningitis. One is as I mentioned before, is extreme of age. So you realize that those who are below 5, especially children, are at a very high risk of getting meningitis because they are complementary or their immune system has not developed well. The second one is the people who have immunosuppression. You can have immunosuppression as a result of maybe you are undergoing some medication to boost your immunity or even to lower some inflammatory disease in your system. For example, those who are going under chemotherapy, for example, they also are at risk of getting it. Those who have other opportunistic diseases, for example, you can have a respiratory tract infection, which can predispose you to get meningitis, because you look at if you look at how it is spread actually, which we'll look at the transmission. One of the mode of its spread is through bloodstream. We call it hematogenous spread. So anything can spread from any organ of the body and go into your bloodstream and cause meningitis. Other thing that can be a risk factor for meningitis is those people who have diseases like, for example, chronic illnesses. We have those who have chronic kidney disease, renal diseases, and liver disease. You remember that liver is one of the key organs in terms of synthesis of immunity organs, immunity complements or immunity factors. So if you have a liver disease, you are at risk of getting meningitis. Yeah.
Thank you so much for that. And what exactly is causing meningitis? Because we've talked about the risk factors that could maybe increase one's chances of getting meningitis. But what exactly is the cause?
Thank you very much. So we can broadly divide the cause of meningitis into two. So we have an infectious cause, and also we can also have an non-infectious cause. So in terms of infectious cause, we have in primary we also learned about those bacteria, viruses, fungal, and parasites. So in terms of bacteria, we can have pneumococcal, we can have influenza, which can be a cause of it. When you look at the fungal, which is so common, we have one which we call cryptococcal, which can be a cause of meningitis. In terms of the parasites, the more common one is Ascaris lubricoides, and they can also have toxoplasmosis as a cause of meningitis. Viruses, you can mention all of them. You can have enteroviruses as a cause of it, and other viruses as well. Yes.
And how is it transmitted? Is it a disease that I could transmit from myself to another person? Is it something that could be transmitted through contact? How is it transmitted?
Yes. Before I go to the transmission, I didn't mention about the non-infectious causes of the meningitis. So some of the non-infectious causes, as I mentioned in the risk group, we have, if you have a malignancy, especially of the brain or the central nervous system, which can be a cause of an inflammatory. Remember, we defined it as an inflammatory disease. So in case anything that causes an inflammation in the brain can breach the blood-brain barrier and also can breach the mechanism, the normocytic mechanism of the brain and cause meningitis. So the transmission, it is transmitted, one way of transmitting is through, we call it droplet effect. So through sneezing and through coughing. Another way that you can get meningitis, remember I mentioned also the under 5. And before I forget, meningitis actually, you can also get in the age group of 0 to 2 months. More commonly happens as a result of mother to baby transmission. We call it MTCT, mother to child transmission. That's another way of you can get the transmission of meningitis. Another way is stool. Stool actually carries some certain kind of bacteria, and it's more in children than in adults. Another way you can get it through hematogenous spread. Remember I said you can have a respiratory tract infection which can get into your bloodstream and cause a meningitis. The other way is, I mentioned, is the contiguous spread. So when I talk about contiguous spread, is you have some neighboring tissues or organs around your brain tissue. So one of them is your ear. So you can have an infection of the ear which can spread to your brain tissue. You can also have something called a disease called sinusitis, which actually affects a lot of people, which can be a way of spreading it to your brain tissues. Another way is you have a defect, especially, remember I mentioned the 3 tissues of the brain. I mentioned about the pia, dura, arachnoid, and the dura. Now the dura is the one that actually, if you have a breach of the dura, maybe as a result of an accident or trauma, it can offer as a breach into which this infection can spread to your brain tissue. Yes.
That sounds scary. And you've mentioned that children are 0 to 2 months, and you've insisted that children are more at risk. But why is that? Why is it that children seem to be more predisposed to meningitis than other age groups?
Yes, but children, I mentioned and I said that if you look at the immunity system, it develops in stages, and children are prone to having the immunity not yet developed fully, which can be a cause of it. And also, as a risk factor, when you look at the age-going children, we talked and we said one of the transmission methods is through coughing, overcrowding, and also sneezing. And you look at the hygiene of the children actually in class or when in the ground, they always have a lot of those contact issues. That's also a risk for respect to them.
Thank you so much for that. And when someone contracts meningitis, how soon do the symptoms start to portray, and what are the signs and symptoms?
Thank you very much. So you can have, when you contract meningitis, you can also actually classify meningitis in terms of acute or a chronic one. And there are some factors that can lead to you showing the infection and also hiding the infection in it. When you have, for example, when you have a chronic disease that you're fighting on, for example, if you're immunocompromised, especially the HIV patient, the elderly, they have silent presentation of these symptoms. But if your immunity is a bit hard to fight it, you'll have an acute symptom presentation. And also depending on which type of the bug or the type of the pathogen that causes this meningitis. So you can have even within 2 to 3 days, and some can even go even months without even showing those signs of the infection. And that's why I said the diagnosis of this thing actually encompasses the symptoms, the signs, your examination, and also your investigation for you to come up with a diagnosis of meningitis. It's actually a diagnosis which can be diagnosed through our investigations that we usually have to do. Some of the signs and symptoms, we call them meningitic symptoms. As any other disease, one of the signs is fever. Fever is actually one of, it's like a response to anything attacking your body. So fever is one of the things. The other meningitic signs that you have is some present with altered mental level status. You can have headache, some have blurry visions, remember, because you have your cranial nerves actually in the brain. So this is an infection that can also affect your nervous, the nerves or the cranial nerves of your brain. You can also have, some also come with neck rigidity, or we call it neck stiffness. And some, as I said, if you have another comorbidity illnesses, you can also come with those signs and symptoms of those comorbidity, like sinusitis, or you have a respiratory infection, you can come with those also signs and symptoms. Yes.
Thank you so much for that. And in a baby that is 0 to 2 months, or in children generally, are these the same signs and symptoms they're going to portray, or do we have something unique other than what we've talked about that could point the mom to maybe my child could be having meningitis, or maybe my child needs attention? Because when you're talking about stiffness of the neck, a mom might not really get that in a 0 to 2 months old.
Very true. Actually, the symptoms or the signs from 0 to 2 months, rather they are non-specific symptoms. So these are symptoms that a mother who has a nursing baby, you can always look at. I mentioned of fever. Fever, you can always tell your baby is hotness of the body, which your mom can elicit from. Some come with what we call seizures, or let's say convulsions. Of course, your baby will not tell you he has a headache. So those are things that you can look at of your baby that has this condition. You have irritability. So maybe so irritable, you try to breastfeed, he's not breastfeeding, he's not responding to breastfeeding. You also have some constitution, we call them constitutional symptoms like vomiting and diarrhea. So those are some of the things that the mom can come on, that the baby can present with. Others also present with respiratory difficulty with breathing. You realize that your baby is actually has an increased work of breathing. When you look at it, you realize that there is a chest indrawing and those kind of the things that you look at for the babies. For the older children, definitely you'll have headache, as I said, and those are the symptoms like neck rigidity, neck stiffness, and vision impairment also.
Yes, thank you so much for that information. Now, earlier you mentioned that meningitis could resort to some complications. What are some of these complications that maybe we're going to be talking about treatment, but before we talk about treatment, what are some of the complications that we could anticipate with meningitis?
Thank you very much. Maybe before I talk of complication, I would like to carry the viewer on how do these infections spread until they get to the brain. So remember, I talked of the modes of the transmission, and we also discussed that you can also, so if you have a bug or a bacteria, so wherever route it gets into your body through, it can get through your respiratory system. So this bug has a way on which it protects itself, for that it can be able to get into intravascular, that is into your bloodstreams. So it fights and it overcomes the barriers of your respiratory or from any other route that it can get into. Once it gets to the bloodstream, it produces some response to the body, where the body now responds by producing an inflammatory cascade of mechanism. So this cascade of mechanism with the bug itself interferes with your blood-brain barrier. We have a barrier that actually protects your brain from anything that is toxic or anything that the body suspects it's not of good use into the body. It's always protected from getting to your brain. So this bug is able to actually interfere with your brain barrier and get into your brain or into your brain tissue, whereby you have inflammatory cascade. The response of the body, when you have that inflammatory cascade, you have something called edema. You can have a cytotoxic edema, you can have a vascular edema, and those kind of. So these are the signs. These are the outcomes of this brain broken barrier by this organism. Some of the complications that we derive from, one is a brain abscess. So brain abscess, it's in Kikuyu. We call it tamahira hakiri. So this organism is able to produce an abscess in your brain. It is also able to produce what we call hydrocephalus. So that's another complication that can be caused. Remember, I talked of the signs and symptoms. I talked of altered mental status. So this is also an effect, a complication that is brought about by this organism. There's another thing that we call SIAD. It's called a syndrome of inappropriate ADH secretion. Once it affects the brain, you will have a way of losing your water into the body. Another thing, as we talked of, we said is seizure. So seizure is a complication. You can also have a focal neurological deficit as as a complication of this disease. Others present with hearing loss if it's not taken care and treated very well. Others also present with some intellectual impairment.
Which now brings us to treatment. What does treatment entail? And can some of these complications be dealt with through treating meningitis? If you treat meningitis primarily, are these complications going to disappear?
Yes, meningitis is curable. For you to approach the treatment first, they said you need to know which kind of organism causes this meningitis. So treatment entails your investigations. Me as a doctor, when you come, I will start with your blood panel work, and maybe which will elicit there is an infection into your body. The clinical and the key thing that we usually do is to analyze what we call the CSF. Remember, CSF I said is a cerebrospinal fluid. So this is what we analyze to usually to detect which kind of bug it is. Is it a bacteria? Because in terms of the biochemistry, you'll be able to tell is it a bacteria, is it a viral, or is it a fungal kind of infection. So the treatment will entail you getting to know, is it a bacteria, is it a fungal, or is it a viral? If it's a viral, you of course treat with antivirals depending on which virus, and if it's a bacteria, you also do antibiotics. So depending on the severity of the infection, that's where we can gauge if we have to do the intravenous, the IV medication, or even the oral medication. We also offer, that's a definitive treatment where you target what is the cause of it. But remember also, these people come also to the hospital with other supportive needs. They can come with conversions, for example. So with our primary and secondary survey, we gauge if he has conversions. We usually use anticonvulsants. If there is an oxygen requirement in terms of distress, we supplement whatever we can see. If it's pain, we give analgesics. So we have both supportive and definitive treatment for that. Yes.
Thank you so much for that. And I don't know if this is a myth, maybe it's something you can help us break down. Can meningitis be induced by certain drugs?
Yes, definitely meningitis can be induced by certain drugs. For example, there are those who use immunoglobulins, which are drugs that are used for that. Even a simple drug, even as metronidazole, can cause. Remember, I talked about the non-infectious. Anything that can trigger the body to produce an inflammatory response or inflammatory mechanism, especially into your brain tissue, is a cause of meningitis. Yes.
Which brings us to people not buying the drugs over the counter, because sometimes we don't even know what are some of the side effects that could bring that drug could bring about. So we're going to be taking a quick short break here at Medicamp. And again, I want to remind you that GTN TV has been nominated for the Kuza Awards. And to vote for us, go to www.kuzaawards.co.ke, or simply send the text Kuza to 15601 and vote for us, because without you, we could not have gotten the nomination. And once again, without you, we are not going to bring this award home. We appreciate you for being our fan. Stay tuned to GTN TV. We are going to be back shortly here at Medicamp. Yes.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahicha Hotel, Murang'a taũni, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Road Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo makoragwo Githunguri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakima Modern House, na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725815641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku. Kuza Awards 2024 ĩrĩ haha na ithuĩ na GTN TV nĩ ĩcagũrĩtwo gĩkĩro-inĩ kĩa TV yaku nĩyo People's Choice Award ta ceceni yaku nĩ gũikia kura yaku. Andĩka ndũmĩrĩri nguhĩ ũkĩandĩka kiugo Kuza ũtũme kũrĩ 15601 kana ũikie kura yaku kũgerera rũrenda nĩ rwa www.kuzaawards.co.ke na wĩkĩrie kura Grassroots Television Network. O rĩngĩ ceceni ya GTN TV gwakinya nĩ gũcagũra ũkwandĩka Grassroots Television Network. Gũikia kura gũtirĩ na marĩhi. GTN TV mũciĩ wa ihenya taranda. Tabarĩra ya imeria rũcinĩ kana gaka ga tarĩki 9 mweri ũyũ tũrĩ kwambĩrĩria thaa 2 cia rũcinĩ nĩ mwaka ĩmwe na RBG Engineering tũkĩrunga ciĩgiĩ wonjoria rũhonge-inĩ rwa waki. Maya mothe ũgĩterebwo nĩ Waithaka wa Kenywa. Ndũkanahĩtũkwo nĩ maya.
Yes, thank you so much for staying tuned here at GTN TV, the home of gifts and talents. My name is Mumbi Mavuti and this is Medicamp. We are on to our second segment and today we are talking about meningitis. We've talked about how it's transmitted, we've talked about the causes, the risk factors, we've even discussed the complications that could result from meningitis that is left untreated, and now we want to talk about prevention. But before we go there, Doc, is it a complication in pregnant women? And when a pregnant woman has meningitis, is it going to be transmitted to the baby? Or is there something that can be done to avoid the transmission?
Yes, thank you very much. As I started, I said, remember meningitis can affect anyone. And part of that, I said in my, those who are actually at risk of getting them are immunosuppressed. Remember, pregnancy is a immunosuppression condition, so mothers are actually at risk of getting the infection. And yes, it's possible to be transmitted to during pregnancy or during birth. Mostly it happens actually during birth. We have those maternal, we call them the maternal flora. For example, the E. coli, listerias. So those ones during, if there is anything that happens during birth or a complication during birth, the baby can actually get infected with. Remember also between the age of 0 to 2 months is when we have a lot of contact between mother and child. And one of the methods of transmission, we said it's sneezing and coughing. So if a mother is infected with it, you can always transmit to your baby during that contact. Yes.
Thank you so much. And according to the World Health Organization, meningitis is more common in the sub-Saharan Africa. Why is that? And I want to believe that we are in that region. So why is that? Is it that geographical factors would affect the spread of meningitis?
Yes, along that sub-Saharan belt, remember environmental factors are one of the key causes that cause actually a risk to spread of it. And along that we have climatic changes actually, on that belt. We have dust, other things that can actually act as a vehicle for the carriage of these bacteria or these parasites. So yes, it's actually common because of the environmental changes. Yes.
Thank you so much for that. And can meningitis be prevented?
Yes, it's preventable. You can prevent meningitis, and one of the methods of prevention is vaccination. So we have vaccination for that, for the meningitis, and some of the vaccines that we usually use is, we call them for the pneumococcal. You can have a vaccine for that. You can also have a vaccine for meningococcal as a prevention for that. Other measures that we can use, remember we had COVID-19 with us, hand washing, maintain your distance, of course in hygiene, and of course when you're coughing, use your hygiene measures of coughing. Always cover yourself when you're coughing, because you don't want also to be a risk to other people. Yes. And
when you talk about vaccination, is that eligible for anyone, or at what point is the vaccine administered? Yes,
vaccine is eligible for anyone, but is more eligible to those, especially those who have immunosuppression. For example, we have those who have undergone something we call splenectomy. For example, those who have a sickle cell disease and affecting. So the spleen is actually one of the immune system organs, and it helps to fight some bugs, for example, the pneumococcal and meningococcal. So when you undergo splenectomy, that is in basic English is the removal of your spleen. So when you undergo that one, you are at risk of getting those infection. Yes.
And also we have cases of people who have become differently abled, all from meningitis. How does that come to be?
Yes, so meningitis, if it's not treated or it's undertreated, you can have a complication of it. And I mentioned one of the complications is what we call focal neurological deficit. So you can have some permanent effect if you have a chronicity of the disease without being treated, which can lead to maybe even paralysis. Some even have paralysis as a result of being affected on some aspect of the brain. Yes.
Thank you so much. And as a country, is there a way we can detect and maybe be able to control outbreaks of meningitis?
Yes, it's possible. And I said one way of detecting and one way is mass education, which we are doing right now as a way of involving the public and also enlightening the public on how you can detect if you have this meningitis or these symptoms of meningitis. So that is one of the way. 2 is hygiene. You observe your hygiene. 3 is when you have those symptoms and those signs, it's always good to always visit the hospital for the cure and also for more enlightenment on the same.
Talking about the symptoms, could meningitis be confused, or do I say, confused, for pneumonia at some point, because these symptoms could manifest more like in pneumonia, and then maybe someone does not take action as fast as needed?
Yes, it's possible to actually confuse the presentation of meningitis with other conditions. Remember, when we were talking about the presentation of the disease to children who are below 2 months or even below 1 year, and we said the children have non-specific presentation of the symptoms, which are irritability, maybe also vomiting and seizures. So it's possible actually to have a non-specific presentation of this. Also, one of route that I mentioned, we talked about hematogenous spread, and we said this infection actually can be caused by even bacteria that actually affects your respiratory tract infection. So if it gets a wind on which it gets into your brain, can also cause meningitis. And you can come with a presentation of your respiratory tract infection presentation, masked with what? With the presentation of meningitis. And remember, I also talked of, I said elderly. Sometimes you can have silent presentation of this. Those who are undergoing maybe chronic illnesses, for example, renal diseases, diabetic or hypertension, you can come with symptom or presentation that points more to those chronic conditions and mask it with with meningitis. Yes.
Thank you so much for that. And I want to believe that it is a collective responsibility, because when you're talking about transmission, it is about, are you cleaning your hands? Are the environments that you are in clean enough so that we don't harbor the bacteria and the viruses that are responsible for causing meningitis? That's where we want to wrap it up, Doc, unless there is something that you would want to hammer on, something that you feel like you need to insist to the public so that we can together curb the spread of meningitis.
What I would like to insist or to tell the public is meningitis is real. It's not witchcraft. It's a disease, or it's an inflammatory disease that affects our brain. And remember, our brain is a central organ that God gave us. And if we don't take care of it, remember I've talked about some permanent or some chronic complication that can come out of this meningitis. We can have a permanent focal deficits, like I talked about. So it's always good to always have a visit and talk with your doctor when you have these symptoms that can be either non-specific or even meningitic related symptoms. It's always advisable, visit your doctor and avoid over-counter medications. Thank you.
Thank you so much. And would our nutrition in any way strengthen us or help us to keep it at bay, or does it have any relation with nutrition, what we are eating?
Yes, definitely it has. We eat healthy because, of course, whatever we eat is whatever actually helps to protect our bodies from diseases. We have vitamins that are key thing in actually protecting our disease, our bodies, and also boosting our immunity. So nutrition is key in terms of building your healthy immune system of your body. Yes.
Thank you so much for that. We are quite enlightened and well educated on matters meningitis, and all thanks to you, Dr. John. Thank you so much for making time for us here at Medicamp.
Thank you.
We appreciate the moment. We appreciate you taking time to enlighten us, and that's why we are going to be wrapping it up. But before I go, have you voted for us yet? Go to www.kuzaawards.co.ke and cast your vote there. Vote for GTN TV, and also if you are using your phone, if you cannot be able to vote online, you can easily text the word Kuza to 15601 and help us bring this award home. We really value you for being our fan. We value you because these steps and these steps that we are taking right now, it's because you've been there supporting us, and we are because you are. Thank you so much for tuning in to Medicamp. Until next Tuesday, let's keep it GTN TV, and remember that your health is your wealth. My name is Mumbi Mavuti. See you.
Thank you.